Hi, my name is Kelsey. I'm a physical therapy student at Campbell University, and today we're going to be talking about the elbow flexion test. This test is used to assess if someone has cubital tunnel syndrome, which is when the median nerve passes through the cubital tunnel, it can become compressed, and then the patient will experience numbness, paresthesia in the pinky and the ulnar side of the fourth digit. So this test, the sensitivity and specificity vary depending on the research that you look at. A study conducted by Bueller and Thayer said the sensitivity was 86 to 93%. In order to achieve the sensitivity of 93%, the patient had to maintain the elbow flexion test position, which is this, for at least 3 minutes in order to achieve that sensitivity. Any less, and the sensitivity decreases. So sensitivity, if you go back to spin and snout, sensitivity helps rule out the presence of that pathology. The specificity of this test was 99% in a study conducted by Novak. So this test is a good test for ruling in pathology as well. So it's a good screening tool as well as a good tool to use to rule in the presence of cubital tunnel syndrome. So to perform the elbow flexion test, the patient's going to be sitting. They're going to be asked to have their arms comfortably by their sides, not in any flexion, no extension. And then they're just going to simply flex their elbows, not forcibly, just in a comfortable position, and then extend the wrists. She's going to maintain this position for 3 to 5 minutes. In order to achieve the 93% sensitivity, Bueller determined that this test needed to be held for 3 minutes continuously. Any less than that, and the sensitivity decreases. A positive test will be determined if a patient complains of numbness, tingling along the ulnar nerve distribution, which again is the pinky and the ulnar side of the fourth digit. So now I'm just going to pretend that Kim is a patient that I'm seeing in the clinic, and I'm going to explain to her how to perform this test and what this test means and all of that. So hi Kim, my name is Kelsey.
Hi.
So what I'm going to do today is called an elbow flexion test. You've been coming in saying that you have complaints of numbness and tingling, kind of in these two fingers. And so this test is just going to help me determine one of the potential causes for that. Okay?
Mm-hmm.
So I'm going to have you do is just sit here with your arms comfortably by your sides, and then I want you to bring your arms up and just like this, and then extend your wrists. And I know it's a long time, but we're going to hold this position for 3 to 5 minutes. So during this time, you can educate your patient and go over anything. You can just talk about any of their other complaints or anything like that while they're maintaining this position. So for time's sake, let's say that 3 minutes is up. Can you tell me where you were having any pain or tingling?
Definitely my pinkies.
Okay. All right, so you can relax your arms down. So that test is a positive test, and it may indicate that one of your nerves that supplies the sensation to these fingers is getting compressed kind of down in this region.